Horses are exceptional athletes, but just like any other athlete, horses are extremely prone to injuries, especially performance horses. Performance horses endure countless hours of practice and competition. This type of work can be very taxing on these athletes. One of the most common injuries for the show jumper is a suspensory ligament tear. So what kinds of horses are most susceptible to a suspensory ligament tear? Any horse who puts stress on their legs is at risk for such an injury. Stress can mean any type of weight put on the horse's legs, such as speed, jumping, advanced movements, and technical gaits. Overweight horses are also at risk because the excess weight adds unnecessary stress on the ligament. Additionally, horses with crooked feet or improper shoeing are also susceptible to this injury because the unbalance in their feet causes extra stress on the ligament. You can't actually feel the suspensory ligament, so the only definite diagnosis is by ultrasound. However, signs of this injury include lameness, heat, swelling, and pain at the site of the injury. So now that we know what types of horses get this injury, next let's dive deeper into what the suspensory ligament actually is. A suspensory ligament is a strong band of tendon-like tissue that lies along the back of the cannon bone between the splint bones, which continues down to the fetlock. The ligament's connective tissue is aligned in longitudinal bundles, which is integral for the ligament's ability to stretch. This ligament acts like a spring to support and extend the fetlock, sustain tension, prevent hyperextension, extend the gait, stretch, and store energy. Overextension is one way for horses to damage their suspensory ligament. Damage involves tearing or rupturing individual fibers or fiber bundle groups. Think of it as like a rubber band. It is strong and stretchy, but if you stretch it out too far, it won't snap back to being as strong as it once was. The suspensory ligament is a pretty similar concept to that. A suspensory ligament tear is a critical injury because not only is it one of the most common causes of lameness, but it also only has a 29% full recovery rate with traditional methods of treatment, and recovery can take over a year depending on the severity of the injury. Full recovery can be defined as the horse exercising at the same caliber it once was previous to the injury. Horses with this type of injury are also very prone to re-injury during the treatment process, which can prolong healing. The traditional regimen for the suspensory ligament injury is rest, ice, and compression. The timeline differs for each horse. However, it is typical to see a horse begin treatment by going on stall rest for approximately 3 months, while also getting their legs iced and/or hosed every day, getting standing wraps, and non-steroidal anti-inflammatory drugs. Being on stall rest means the horse is restricted to only being in its stall for about 3 months straight. This can be very mentally challenging on the horse because they are used to being ridden and going in the pasture, so when they are on stall rest, they have no outlet to release their energy. After stall rest, they can begin hand walking, and after that, they can begin light under saddle work, which the timeline for this is all at the discretion of the veterinarian. If you try to bring a horse back too quickly, they become more prone to re-injury, and the ligaments could heal slowly and poorly if weak scar tissue replaces the once strong and stretchy tissue. The entire rehab process is very slow and tedious. The expected healing time is varying depending on the injury, but takes on average 9 to 12 months. In addition to traditional healing methods, there is some new technology that can help speed up the healing process. However, it is very important to note that these methods are not a treatment, but rather a therapeutic tool and are often very expensive. Some of these methods include shockwave therapy, therapeutic ultrasound, and laser and light therapy. All of these therapies have similar effects, which is to increase blood flow in the region, mask pain, and encourage quick healing of the ligament. Scientists are also now using stem cells to heal the suspensory ligament. Scientists use mesenchymal stem cells from adipose tissue or bone marrow and induce these stem cells to differentiate into tenocytes, which results in a quicker healing and higher likelihood of a full recovery. However, this method is still new and not yet widely adopted. Hopefully this video gives you a little insight on this injury. This is a difficult injury because there aren't many preventative methods, and a lot of the healing process relies on the unpredictable horse staying out of trouble and not causing re-injury. This process is slow, and oftentimes even when the horse is healed, it cannot compete at the same caliber it once was, which drastically decreases its value. However, there will always be a job for every horse, whether it is a high-level performance horse or simply as a pasture ornament.